you. Are we ready, folks?
See if I can get my instructions then. Good morning, everyone. Welcome to Jamaica House, the Office of the Prime Minister, and to our weekly Jamaica House media briefing. I want to, first of all, apologize for the late start. We were scheduled and we were expecting. We had a little delay with one of our guests, so we want to apologize to you, colleagues, for the late start. Thanks also for responding to the notice and the invitation. This morning, as always, we will hear from our Information Minister on some of the issues coming out of Cabinet. And in the wake of the deaths of the babies at the health institutions, UWI and Cornwall Regional, we have also invited the chairman of the UWI, the University Hospital of the West Indies, the board, Mr. Sterling Stories, to join us. He's here with us this morning, sitting next to Minister's left. And beside me is Dr. Marion Bullock, the CAS, who you are all familiar with. They will be updating us on the situation pertinent thereto. First, I will invite Minister to share with us some of the decisions coming out of this week's Cabinet. Minister.
Good morning, members of the media. We want to thank you for coming. We want to also say good morning to our viewers on the PBCG and those joining us on the World Wide Web. Cabinet has approved a contract for the purchase of 17 Renault garbage compactor trucks for the National Solid Waste Management Authority. The NSWMA's island-wide fleet for the collection and disposal of domestic and commercial waste consists of 52 units. To operate at optimal efficiency, the authority needs a fleet of approximately 172 trucks. Since 2013, supplementary contractors have been engaged and the NSWMA has overall access to 126 trucks. Despite this, however, there is still a severe backlog in the collection due to the turnout of less than 50% of the trucks required from the contractors. There is an urgent need to replenish the NSWMA's fleet. Renault garbage compactors have proven more reliable than others, as spare parts for these vehicles are easily accessible locally. The trucks will be delivered within 6 to 8 months, and the contract for these 17 compactor trucks is valued at €1,977,500. Cabinet has given approval for the introduction in Parliament of Campaign Finance Reform under the Representation of the People's Act, Amendment Bill 2014. As you may know, the bill was tabled in Parliament yesterday and will be debated in the coming weeks. The bill seeks to implement recommendations from the Electoral Commission of Jamaica in respect of campaign financing. Among some of the specific amendments provided for in the bill are restrictions to political spending with a view to preventing corruption, promotion of political equality, and keeping influence of special and private interests under control, preventing the control of government and the use of power for private benefits, and provision of transparency and accountability of elected officials. And we will not answer questions on this bill today because it will be debated week after next. Cabinet has approved a contract with the Canadian Banknote Company Limited for the procurement of 750,000 blank Jamaican passports. The contract is in the amount of US $3.7 million. The current order is expected to satisfy the local and overseas demand for Jamaican passports for the next 3.5 to 4 years. The blank passports are personalized by PICA using a passport issuing and control system, which is supplied and maintained by Canadian Banknote Company. Over the years, there have been upgrades to the passport system, and since 2013, these have included new printing technology and increased security features. A further upgrade with the introduction of facial recognition system will come on stream by the end of this financial year. The Sam Sharp Teachers College in St. James is to benefit from a diagnostic and early childhood center to complement its preparation of trained teachers with specialization in early childhood education and special education. Cabinet has approved a contract to Food for the Poor for the construction of the center at a cost of $50,640,282. Presently, there is only one public educational institution for children with special needs across the parishes of Trelawney, St. James, Hanover, and Westmoreland, and that is the Landyler School of Special Education. The construction of this additional facility at Sam Sharp's Teachers College is expected to ease the current overcrowding and long waiting period which children in need of this service must undergo. The facility will have 3 diagnostic classrooms, an assessment room, and a multi-purpose auditorium and other amenities, and construction is expected to be completed in this fiscal year. Cabinet was briefed on Monday, and yesterday, Minister Fenton Ferguson spoke in Parliament on the bacterial outbreak at the University Hospital of the West Indies and the Cornwall Regional Hospital. Today, I want to express the condolences of the government to the families of the baby who died from the infection at our hospitals. Today, we have with us Dr. Marion Bullock-Ducasse, our Chief Medical Officer, and we also have the Chairman of the University Hospital of the West Indies, Mr. Sterling Suarez. But before I go to them, I want to speak to you about something that has been making the rounds on the news this morning. Minister Fenton Ferguson was quoted as saying, "I don't want anyone to give any impression that these are babies in the real sense." I spoke with Minister Ferguson this morning, and he explained to me that he corrected what he said yesterday when he realized there was a slip of the tongue, and I want to repeat that. That was not what he meant to say. What he meant to say was that these are premature baby versus full-term babies. And now, I go to Dr. Marion Bullock-Ducasse first.
Thank you, Minister Faulkner, Mr. Suarez, Mr. Robinson, members of the media. I would like today to start by, on behalf of the Ministry of Health and myself personally, offering condolences to the parents and the families of the babies who have died in this outbreak that we are seeing at the University Hospital and the one at the Cornwall Regional Hospital. The technical team at the Ministry of Health continues to work island-wide with our team members in the field to ensure the best outcome for our newborns. We are aware that with respect to babies who are born and are premature, that they do face a higher risk of infections due to their poor immune systems, which have not been fully developed, and also the fact that some of them are born with other illnesses. We therefore try to ensure that we take all of the necessary precautions. I would like to state that at present we have had a total of 42 babies who have been affected in the 2 outbreaks that have occurred at the Cornwall Regional Hospital and the University Hospital of the West Indies this year. Unfortunately, we have had to report on 19 deaths, but I am happy to report that in terms of infections, we have not seen any new infections at our hospitals, and for the Cornwall Regional Hospital, the last case was seen on the 14th of this month, and for the University Hospital, the 15th. Those are the last new cases. So the intervening period, we have been taking measures to ensure that we heighten all of our precautions to minimize any spread. We continue to monitor very cautiously and to date, for those 2 dates that I quoted, we have had no new infections. I wanted to speak in terms of the actions that have been taken by the Ministry of Health and the team, and to say that with regards to the actions taken, the response from the Ministry of Health and the regions and parish health departments, it was immediate. Once information was received in terms of any potential cluster of cases or an outbreak at both of these hospitals. With regards to the University Hospital of the West Indies, the first information of an outbreak taking place currently was received on the 16th of October 2015. The University Hospital was immediately contacted to verify this, and a report on the situation was requested. The Ministry of Health technical team also participated in meetings on the 17th and 18th, and in a meeting convened by the Chief Medical Officer on Monday the 19th, a review of all the data was conducted and the appropriate guidance in terms of the continuing measures to minimize any loss of life or spread of infection. I would like to point out that at no time did the Chief Medical Officer or the Ministry of Health units, which are in the routine system to receive information, receive any advisories of these outbreaks. The information that was purported to have been sent in July 2015 was retracted and corrected, as this was not evident in terms of that this had actually happened. And in the 2 letters which were sent in early September and received in the ministry on the 8th, this reported on cases seen in June between the 4th and the 14th, and in October from the 3rd to the 21st. The further reports from the university were received on the 19th of October as requested by the Chief Medical Officer on the 16th. And for the Corner Regional Hospital, the process was similar. Once information was received, a review was conducted. The minister was advised on the 12th, 2 days after the information was received and the review was completed, and a team was dispatched on the 13th of October. And since then, we are pleased to report that with the enhanced measures, we have not seen any additional cases. With regards to the actions taken, I would like to point out that the Ministry of Health recommended to both hospitals that for the work to be done, it meant heightening infection prevention and control according to the ministry's manuals, as well as the use of the Ministry of Health's Neonatal Services Manual on policies, procedures, and protocols. This meant isolating the babies who were infected, making sure that all new admissions were in a different area, the provision of additional equipment and supplies, the hiring and redeployment of staff, close monitoring of the environmental situation and the processes, and the provision of daily reports. Weekly monitoring continues of this by virtue of visits, but daily contact is made with all hospitals. The Ministry of Health will continue to collaborate with its partners, and the Pan American Health Organization dispatched a team to Jamaica between the 20th and 23rd, and their assessments were also done, and their report is awaited. This ongoing effort to improve our maternal and child health services continues, also with the input of projects such as the PROMAC project, and the Minister has spoken extensively about this with the grant of the 22 million euros. I would like to close by saying that the Ministry of Health continues to work alongside the teams on the field at all hospitals to ensure that our protocols are enforced and that our reporting mechanisms through our surveillance system, which asks that hospitals report all outbreaks to their parish health departments and the Ministry of Health National Epidemiology Unit, that system is enforced. Thank you.
Thank you, Dr. Ducasse. We now open the floor for for your questions. Lincoln. Althea?
Good morning. Althea Saunders from the Jamaica Observer. Minister Faulkner, I had a question for you regarding the NSWMA. You said that the turnout of trucks from the contractors is under 50%.
Right.
Are those contractors with whom the NSWMA has binding contracts?
I believe that those are approved contractors, but don't hold me to that. I can check for you because this is based on a brief we got at the cabinet, so I don't know all the details. But if I'm not mistaken, they are contractors who the National Contracts Commission has approved. But I will check for you. So let me check for you, and I'll get back to you with that information.
Okay. My question for Dr. Ducasse. We have heard of 42 babies who have been infected, and that's between the two hospitals that have been mentioned. Can you say, in terms of the other facilities, the other major institutions, such as the Victoria Jubilee Hospital, which is a maternal institution, what has been happening there?
For 2015, we have no reports of any clusters of cases there. And indeed, for 2015, the only outbreaks that we have seen have been at the Cornwall Regional Hospital and the University Hospital of the West Indies. 2 outbreaks each. The University Hospital had an outbreak of an organism called Serratia marcensis from June to September 2015, and the current outbreak, which is mainly of the Klebsiella organism, and that is from August to present. At the Cornwall Regional Hospital, they had an outbreak from June to July of Klebsiella, and the current outbreak from September to present.
Okay. Anything from the Bustamante Hospital for Children?
They have not had any outbreaks for this year of any organism in their special care nursery.
Edmond?
That report will be provided very shortly, and prior to the team returning, well, 2 members of the 3-member team will return for the period 2nd to 6th November to assist in carrying out assessments at other hospitals. With regards to the sharing of findings, the Minister will comment on that at the appropriate time once the report has been received.
Hey, Dr. Ducasse, Stephanie Hamilton from IRFM. I am wondering if you have received any reports from the St. Anne's Bay Hospital as it relates to an infant being infected.
Yes, the Ministry of Health received a report yesterday of 1 child who has a bacterial infection. The ministry had immediate dialogue with the doctors at the hospital. We requested additional information, which was reviewed last evening, and a team from the Ministry of Health Head Office, a senior team, including our national epidemiologist and our chief nursing officer. This team is currently at the St. Anne's Bay Hospital conducting an assessment and to ensure that the appropriate recommendations are in place. This, I should point out, is not an outbreak. This is 1 case that has been identified, and it was appropriately reported through our survey and system channels, and therefore we were able to respond immediately by assessing the situation yesterday, also looking at the laboratory data, having dialogue, and the senior Ministry of Health team is on location to gather additional data and provide guidance to ensure that there is no further spread of this infection. We will continue to monitor on a daily basis.
Okay, Krista Campbell, TVJ. Dr. Ducasse, you said that the reports that you received from the 2 named hospitals, Cornwall Regional, was October 14th? And
No. No, the Cornwall Regional Hospital report came in initially on the 9th into the 10th. It was reviewed, additional data received, and the dialogue continued, and a team was at the hospital on the 13th to provide the additional guidance. I would like to point out that each hospital has in place an infection control committee and team that initiates all of the required protocols once they suspect this at the hospital. This is even prior to any laboratory confirmation or awaiting instructions from the Ministry of Health. So actions are already being taken based on our protocols prior to any intervention by the Ministry of Health.
Based on the protocol, though, how long should it take for the Ministry of Health to be alerted in instances such as these?
For outbreaks, it is immediately on suspicion and within 24 hours.
But then the outbreaks would have taken place months before this was done. So it wouldn't have been an immediate action then, as you reported earlier.
No, it is outbreak by outbreak. When an outbreak occurs, appropriate measures are taken, they are contained. When another one occurs, then the same actions are taken.
Morning. Question for Dr. Dukas. Yesterday it was raised by an opposition member of parliament about an infection at the Bustamante Hospital, MRSA. I know my colleague had raised similar questions. Want clarification. That is there any information or any confirmation of that MRSA infection at the Bustamante Hospital?
Yes. Your colleague, at the time, her question was looking at special care nurseries. That was my interpretation. In terms of the intensive care unit, that's a separate facility. And yes, there was a small outbreak there in July this year, and the Ministry of Health worked alongside the team to contain that. There were 3 cases in that outbreak. Bear in mind, these were in long-stay patients who had been in the unit for months. But yes, we are aware of it. All of the appropriate measures were taken in collaboration with the Ministry of Health, and the containment was achieved.
Were there any casualties or any persons still infected?
Currently in the island? Yes. In terms of the current outbreaks that are occurring, we still have a total of 8 babies that have been affected, and they are being appropriately treated. We have the appropriate numbers of antibiotics that we need in terms of the range. We have it in appropriate quantities, and there has been no issue with that. In terms of the current, and I'm quoting for the 2 outbreaks from Cornwall Regional Hospital, 2 from University Hospital, that is the 42 babies that we refer to with the 19 deaths that the minister reported yesterday.
Do I have any other questions?
Mr. Suarez, not...
Abco? Are you good? Okay. All right.
Not specific to the issue at hand, but it's a concern that I've got information on earlier this year. The Public Health Department had to visit the minor operating theater at the University Hospital of the West Indies, and I was told that theater was shut down for some time. Refurbishing and other works were done. I'm told that there were issues in terms of the condition, unhygienic conditions in that particular ward. I called Dr. McCartney and spoke to him about it, and he said he was unable to comment on it, that I should speak to the CEO. I tried many times to get the CEO back then, but was unable to get a comment from the CEO. Could you tell us what the current situation is regarding minor operating theater at DOA?
Good morning, distinguished ladies and gentlemen of the press. Firstly, let me apologize for my late arrival. I was the one that held up the proceedings. I was meeting with the senior staff and the unions separately at the University Hospital. It's the first I'm hearing And I tell you why. I was only recently appointed as chairman, and it was not brought to my attention in all of the emergency meetings that we have had. Our first board meeting was last week, Wednesday. We had an emergency meeting on Saturday, and nothing has come to my attention. What I do promise you is that I will inquire and advise you accordingly. If you leave me with your number, I'll get back in touch with you.
Sir Abko? No, we're hearing you, man. Go ahead. Yes. Abko, we can hear you. No, go ahead. All right, it's not. Can we get another microphone? I'm hearing him, though. Can we get another microphone for Abko, please? Oh, it's on now. Okay.
Thank you. Question to the Chief Medical Officer. The ministry had committed to conducting a review of whether to make the audit into the sector, the conditions in the sector, public. Approximately 54 days ago, what is the outcome of that review? Will it be made public?
The situation has not changed with regards to that audit.
Is any mention made in the audit of the infection outbreak, Klebsiella and Serratia, pardon my pronunciation, and dead babies in the audit?
Can you repeat it, please?
Is any mention made in the audit of the infection outbreak and the dead babies?
No, there is no mention in the audit of these outbreaks. The nature of the audit, it is looking at the actual practices with regards to the protocols, and no mention was made in the audit reports.
Okay. I've been told that you have plans to proceed on retirement sometime shortly. Is that true?
The Ministry of Health will determine that.
Do you have any plans to do so?
My plans are in keeping with those of the Ministry of Health.
It has been entered into the public domain that you became aware of the situation concerning the bacterial infection at the UHII on September 7th. Certainly, you were informed then. Why did you not tell the minister?
As I had said earlier, the letter of September 7th, there were two. One spoke about cases that occurred from June 4th to 14th. That had been contained, and there was no mention of any current case. The other letter spoke about cases that had occurred in August. There is no need in our protocol to advise the minister of all reports that come from all hospitals about all matters. There was no indication of any current outbreak, and as I said earlier, the first indication of an outbreak at the University Hospital of the West Indies was received on October 16th. Immediately contact was made with the hospital to ascertain what was happening.
During this whole situation that came to public attention on October 16, have you at all considered your future?
My future is something that I consider at all times.
Some folks have said you should step aside. What do you say to that? Do you think you should?
That is what they have said.
Abko,
do you agree?
Mr. Sterling, there was a meeting on the weekend, I believe it was.
On Saturday.
On Saturday. Yeah. And Mr. Sterling will speak a little bit to what happened in terms of the letter and when these letters came and what came. Mr. Sterling.
Do you wish for me to answer that, sir?
Yes,
and
I
think
you should.
The matter at hand is one in which it was alleged that a particular letter was written to the ministry on, I think it's the 2nd of July. 2nd of July, to advise of the first sepsis outbreak. That never materialized as we reviewed all the documentation at the meeting, and it was withdrawn that the letter was sent. As it related to the other outbreaks, as previously mentioned by our CMO, the first suspicion that you have of an outbreak, which was June 4th, it should have been reported to the ministry. Somewhere in the interregnum, the first report that I saw was dated June 25th in terms of a fulsome report stating that there was this outbreak and that it was contained. Therefore, there was no need for any further action. That's what it concludes. The next outbreak that occurred was sometime in the latter part of September. And that was when the other report was sent in saying that it was, I can't pronounce the name, Klebsiella, as against the serratia, which was the first outbreak. And that report went to the ministry, and immediate action was taken in regards to what had happened and how we are going to deal with it. And it was done expeditiously as far as the reports are indicating. Going forward, it's very important that we understand that there will be, and there is no guarantee that you can eliminate any type of, we call it, I just use the common term, germs, in any hospital, because hospitals are places where germs are carried every day, because you have ill people in the hospitals, and those people, whether it's a bed sore, whether it's a cough coming off, and a lot of them are waterborne. And therefore, you and I visiting someone in the hospital, and we forgot to wash our hands and we may touch them, we can also pick up that germ and carry it on to someone else. So it's very important that we try to understand that the containment that we speak about and the last reported case, you cannot even at this particular time say that there will not be another case. Because you wait, and just for your information, when a case is suspected, they do the culture, and after they do the culture and they grow the virus, then they determine what it is and how it's going to be treated, and then it is now confirmed what it is. So I understand your concerns. It is also our concern, and we are putting in place all the necessary measures to ensure that the reporting protocol is not breached again.
Thank you so much. That has been helpful, but my question was in relation to the CMO, the Chief Medical Officer, being told on September 7, and I had asked why she didn't tell the minister, and she has answered it very capably. But what I had asked, which was not answered, I asked the Chief Medical Officer regarding the view that the buck should stop somewhere, and a consequence of this whole development is that you should step aside. I was asking whether you agree.
As far as I am aware, my personal time at work is not the subject of this press briefing. With regards to where the buck stops, the Ministry of Health has an overall responsibility for the health sector. The persons who work in the health sector have a responsibility to adhere to the norms and standards and the protocols with regards to how we carry out our practices, and also with regards to how we report on cases, to ensure that the appropriate actions are guided and taken at the relevant levels.
We take one more question. All right, we take two more. Yes.
We've heard that these type of infection outbreaks are normal, commonplace. Could we get some information on what happened last year? We know of 42 this year. What was it last year and the year before?
All right. In terms of the outbreaks that have been reported to the ministry, I do have some historical data, and for last year in 2014, we had 3 outbreaks in our special care nurseries. 2 were at the Cornwall Regional Hospital and 1 at the St. Ansby Hospital. And we continue to ensure that we strengthen our surveillance systems and to train and retrain our staff and sensitize them to ensure that they report. It is not a matter of just tracking the numbers. It is a matter also, and most importantly, to ensure that the reports are provided through the channels that are set out and also on a timely basis. It therefore means that the appropriate actions can be taken at all levels. Because when the hospitals report to the health departments in their parishes as required, the local public health team will then join the investigation, the assessment and provision of guidance, and the same thing happens with the teams at the regional level and ultimately the national level.
Edmond?
Mr. Suarez, based on a comment you made earlier, I must ask you, are members, staff members at UHW arrested?
Not at all, based upon the meeting I had with them this morning.
Okay. Could you share with us if there are any concerns in relation to
I didn't have the time
issue?
to go through with them if there were any issues. I did ask the question, and I said, if you have any issues, please let me know. But I had to leave them to come here.
Okay.
So I can't answer that particular question. But suffice it to say, they are quite happy with the direction in which this new board is moving. And they all exclaimed that this morning.
Good. Thank you.
Well, I want to thank everybody. Alfia, I will have the answers for you in a little bit. Thank everybody for coming. We want to thank our viewers on the PBCJ and those joining us on the World Wide Web. We want to thank Dr. Marian Bullock-Ducasse and Mr. Sterling Suarez. Thank you very much and have a great day.